You sit down in the bathroom, you feel the urge, you know something needs to come out, and then nothing. Or worse, the beginning of something that simply will not move. You push, you strain, you wait, you try different positions, you give up and walk away hoping it will resolve itself later. And later turns into hours, and hours turn into another day, and the discomfort builds, and the worry creeps in, and you start to wonder whether something is seriously wrong with you. If any of this sounds familiar, you are not alone, not even close. This is one of the most common digestive complaints I hear from patients, and it is also one of the most under-discussed, because most people are too embarrassed to bring it up. They suffer quietly, they self-diagnose on the internet at midnight, they try whatever they can find in the kitchen, and they often do things that make the situation worse rather than better. My name is Dr. Sarah Jenkins, and today we are going to have an honest, practical, slightly cheerful conversation about what is happening when stool gets stuck, why it happens, and what you can actually do about it starting today in ways that are safe, gentle, and effective. I promise to keep this useful and clear. I also promise not to use any words that would embarrass your grandmother. Stay with me. By the end of this conversation, you will have a toolbox of strategies you can use the next time this happens, and you will understand your own body in a way that most people never do. Let me start by explaining what is actually happening when stool gets stuck, because once you understand the mechanism, everything else makes sense. Your large intestine, the final stretch of your digestive tract, has one main job in its last section. It absorbs water from the waste material that has passed through, gradually shaping it into the formed stool that eventually arrives in the rectum to be released. The rectum is essentially the holding area, the loading dock, the place where everything gathers before the final step out. When everything is working well, this process is smooth. Water content is balanced, the stool is soft enough to pass easily, but formed enough to stay together. The signals from the rectum reach your brain, you respond by getting yourself to the bathroom, and the natural mechanics of the body do the rest. When things are not working well, several things can go wrong. The stool can become too dry and hard because too much water has been absorbed, or because not enough water was there to begin with. The muscles that are supposed to coordinate the release can become uncoordinated, often because of habits, posture, or chronic straining. The signals between the rectum and the brain can become confused or weakened, particularly in people who have repeatedly ignored the urge to go. And the actual position of the body during the attempt can work against the natural anatomy in ways most people never realize. The result is the experience millions of people share, but rarely discuss. Stool that is there, that needs to come out, that simply will not move. Are we together on this? Then let us talk about how to fix it, because the solutions are genuinely simple, and most of them you can try right now. The first and most important thing I want you to know is this. The single change that helps more people more quickly with this exact problem is changing the position you sit in when you go. This is not a joke. This is not a trick. This is anatomy. The modern toilet, the one we have all grown up using, was designed for convenience and cleanliness, not for the natural mechanics of how the human body was meant to evacuate. When you sit at a 90-degree angle on a standard toilet, there is a muscle called the puborectalis muscle that wraps around your rectum and creates a slight kink in the natural pathway. This kink is helpful when you are walking around because it keeps things in place. It is unhelpful when you are trying to release because it creates a bottleneck that you have to work against. When you raise your knees above the level of your hips, that kink relaxes. The pathway straightens, and what was stuck suddenly has a much easier time moving. The practical solution is a small footstool placed in front of the toilet. raising your knees while you sit. The most well-known commercial version is sold under the brand name Squatty Potty, but any sturdy stool of the right height will work. A small step stool from a hardware store, a box that holds your weight, even a couple of thick books in a pinch. The change in mechanics is genuinely dramatic. Patients who have been struggling for months sometimes find that this single adjustment, used consistently, resolves most of their day-to-day difficulty. It is one of the most useful and most underused interventions in this entire area of health. If you take only one practical tip from this entire conversation, take this one. Try the footstool today. The results often surprise people. The second strategy is hydration. I know, every health video talks about water. But for this specific problem, water is genuinely central, and the mechanism is worth understanding. Remember what I said about the large intestine? It absorbs water from waste as that waste passes through. If you are well hydrated, there is enough water available throughout your system, and the stool that arrives in the rectum is appropriately soft. If you are dehydrated, the intestine pulls extra water out, leaving stool that is hard, dry, and difficult to pass. For someone who is currently dealing with stool that feels stuck, increasing water intake immediately makes a difference, but not always as fast as people hope. It can take a day or two for improved hydration to soften what is already in the rectum. The practical approach is this: drink a full glass of water first thing in the morning before anything else. Continue sipping water throughout the day, aiming for the steady, moderate pattern I have talked about in other conversations. Pay attention to the color of your urine as a guide. Pale yellow means you are hydrated. Dark yellow means you need more. For someone who is currently stuck, a warm beverage in the morning can help. A glass of warm water, a cup of warm herbal tea, even a small amount of warm prune juice can stimulate the natural reflexes of the digestive tract and help things begin to move. The third strategy is one that I love because it works so reliably and is so available to almost everyone. Eat fiber, but eat it in the right form. Fiber is the part of plant foods that your body does not digest. It passes through your digestive tract largely intact, and as it does two important things. It adds bulk to your stool, which helps the muscles of your intestine move things along through normal contractions. And when it is the right kind of fiber, it holds water, which keeps the stool soft and easy to pass. The two main types of fiber both matter. Soluble fiber, found in oats, beans, lentils, apples, pears, berries, and many other foods, forms a gel-like substance in the digestive tract that softens stool. Insoluble fiber, found in vegetables, whole grains, and many fruits, adds bulk and supports the movement of waste through the intestine. The practical approach is to build fiber into your meals every day. A breakfast that includes oats or a piece of fruit, a lunch that includes vegetables, beans, or a salad, a dinner that includes vegetables again, snacks that include fruit or nuts rather than processed foods. Two specific foods are worth mentioning because they help reliably with this exact problem. Prunes, eaten as a small handful each day, are one of the most consistently effective foods for keeping stool moving. They contain both fiber and natural compounds that gently stimulate the intestine. A few prunes in the morning or stewed prunes with breakfast can make a real difference. Kiwi, eaten daily, has been shown in research to improve stool frequency and ease in people who struggle with constipation. 2 kiwis a day, particularly with the skin if you can manage it, is a small, pleasant intervention that often works. A caution. If you are not used to eating fiber, please increase it gradually. Going from a low-fiber diet to a high-fiber diet overnight will produce gas and discomfort that you do not want. Add fiber slowly across a couple of weeks and drink plenty of water as you do, because fiber without enough water can actually worsen the problem. The fourth strategy is movement. Your digestive tract responds to movement. The simple act of walking stimulates the muscles of your intestine in ways that promote the natural movement of waste through the system. Sitting motionless for hours, conversely, slows everything down. For someone who is currently dealing with stool that feels stuck, a brisk walk for 15 to 30 minutes can sometimes do what nothing else has done. Even gentle movement helps. Stretching, yoga, a few minutes of standing and walking around your home. The longer pattern matters too. People who are sedentary throughout their day have higher rates of chronic constipation than people who move regularly. The body that moves is the body whose digestive tract moves. Building daily activity into your life, even moderate activity, is one of the foundations of good digestive health. The fifth strategy is one that almost nobody talks about, but that I find genuinely important. Pay attention to the urge. When your body signals that it is time to go, listen. Get to a bathroom. Do not put it off because you are busy. Do not delay because you are at work or in a public place and you would prefer to wait. The urge is a signal from your body that the timing is right, and ignoring that signal repeatedly trains your body to send weaker signals over time. People who have spent years ignoring their bodily signals often find that the natural reflex has dulled. The stool sits in the rectum without the brain registering it as urgent. The result is that what should have been a brief, easy process becomes a chronic struggle. Rebuilding the natural rhythm takes time, but it begins with a simple practice. When you feel the urge, respond to it. When your body has not given you a clear urge, particularly in the morning, give yourself 10 to 15 minutes of unhurried bathroom time anyway. This is sometimes called training. You sit, you breathe, you do not strain, you do not force. You simply give your body the time and space to respond if it is going to. Many people find that within a few weeks of consistent practice, their morning rhythm becomes more reliable. The sixth strategy involves what to do in the moment when you are sitting on the toilet and something needs to move, but it is not moving. First, relax. I know that sounds simple, but the tension that builds when you have been struggling actually works against you. The muscles you need to relax for stool to pass are the same muscles that tighten when you are tense. Take a few deep breaths. Let your shoulders drop. Soften your jaw. Soften your belly. Second, use the footstool we talked about earlier. Get your knees above your hips. Third, do not strain in the way most people strain. Hard, forceful pushing actually tightens the pelvic floor muscles in ways that make things harder. Instead, use a gentler technique. Take a breath in. Let it out slowly through pursed lips as if you are blowing out a candle while bearing down gently. This technique, sometimes called blowing while bearing down, uses your diaphragm and abdominal muscles to push from above without engaging the pelvic floor muscles that would resist from below. Fourth, give yourself permission to walk away. If nothing is happening after 10 or 15 minutes, do not sit there for an hour. Get up, move around, drink some water, try again later. Sometimes the body needs time. Enforcing the issue produces more harm than good. Fifth, do not strain so hard that you cause damage. Repeatedly straining hard can contribute to hemorrhoids, to small tears in the tissue, and to a worsening of the underlying problem. If something is not moving, the answer is rarely to push harder. The answer is to address the upstream factors that are making the situation difficult. Now, I want to talk about a few specific situations and what to do about them. If you have not had a bowel movement in 3 or more days, and you are uncomfortable and home strategies are not working, it is reasonable to use a gentle, short-term laxative. Over-the-counter options like polyethylene glycol, sold under names like Miralax, are gentle. work by drawing water into the stool, and are safe for most adults to use occasionally. A glycerin suppository, available without prescription, can also help by drawing fluid into the rectum and stimulating the urge to go. These are reasonable short-term tools when home strategies are not enough. Stronger stimulant laxatives like senna or bisacodyl work, but they should be used sparingly because regular use can make the bowel dependent on them and worsen the underlying problem over time. If the stool feels like it is right there, just inside the rectum, and simply will not come out, a glycerin suppository can be particularly helpful. So can a small enema using warm water or a commercial preparation? These should be occasional tools rather than regular habits, but for someone who is genuinely stuck, they can provide immediate relief. If you have tried all of the above and you are still struggling, please see a doctor. Chronic constipation that does not respond to standard approaches deserves a proper evaluation. There can be underlying causes, including medications you are taking, thyroid problems, neurological conditions, or in some cases conditions of the pelvic floor muscles that benefit from specific physical therapy. Let me also mention briefly some things to watch out for, because I want you to know when this is something more than a routine problem. If you have new constipation that came on suddenly and persistently, particularly after age 50, please see a doctor. Sudden changes in bowel habits in older adults deserve a careful evaluation. If you see blood in your stool, see a doctor. Small amounts of bright red blood are often from hemorrhoids and are not serious, but it deserves to be checked. Darker blood or blood mixed throughout the stool deserves prompt attention. If you have unexplained weight loss along with constipation, please see a doctor. If you have severe abdominal pain, vomiting, or the inability to pass gas, do not try to manage this at home. These can be signs of a bowel obstruction or other serious condition that requires medical evaluation. If you experience severe pain when trying to pass stool, or if you feel as though something has torn, please see a doctor. Small tears in the tissue around the anus are common and treatable, but they need proper care. These cautions are not meant to frighten you. The vast majority of stuck stool is a simple, manageable problem that responds beautifully to the strategies we have talked about today. I just want you to know when to seek help, because there are situations where home care is not enough. Let me tell you about a patient I will call Mrs. Linda. She was 64 years old when she came to see me, embarrassed but desperate. She told me she had been struggling with constipation for years, sometimes going 4 or 5 days between bowel movements, and that when she did go, it was a long, painful struggle. She had tried various things. None had really helped. We talked through her habits. She drank 2 cups of coffee in the morning and not much water for the rest of the day. She ate a relatively low-fiber diet focused on convenience foods. She spent most of her day sitting. She had developed a habit of ignoring her body's signals because she was always busy. She strained hard when she finally did go. We did not change everything at once. We started with the most achievable changes. She bought a small footstool for her bathroom and began using it every time. She started drinking a glass of warm water first thing in the morning. She added 2 kiwis to her daily routine. She began taking a 15-minute walk after breakfast. She gave herself unhurried bathroom time each morning, even when she did not feel urgent. Within 2 weeks, her pattern had begun to shift. Within a month, she was having a bowel movement most days comfortably without straining. Within 3 months, she told me she had not realized how much of her daily mood and energy had been affected by what was happening or not happening in her digestive tract. I am not telling you this story to suggest that her problem was simple. Chronic constipation can have complicated underlying causes, but for most people, The foundational strategies we talked about today, applied consistently, make a remarkable difference. That is the offer I am making to you today. Practical tools, simple changes, and more comfortable life beginning soon. If this conversation has helped you, share it with someone in your life who would benefit. Yes, the topic feels awkward. Yes, people do not want to talk about it, but the relief on the other side of an honest conversation is worth a little awkwardness. And tell me in the comments. Tell me what has worked for you. Tell me what you wish you had known sooner. Tell me whether you are going to try the footstool, because I know some of you are skeptical and I want to hear how it goes. The community in those comments helps more people than you know. Digestive health is one of the most important and most under-discussed aspects of overall well-being. The body that releases waste comfortably and regularly is a body that feels good. The body that does not is a body that suffers in countless small ways that affect mood, energy, comfort, and quality of life. The strategies I have shared with you today are not dramatic, they are not expensive, they do not require anything you do not already have access to. They simply require a willingness to take this part of your health seriously and to try a few simple changes that, taken together, can transform your daily experience. Take what you have heard today, try the footstool, drink more water, add some fiber gradually. Move a little every day. Listen to your body, be patient with yourself, and give yourself the gift of comfort in this most ordinary, most universal, most important corner of your daily life. Everything I have shared with you today is for educational purposes to help you address one of the most common and least discussed problems in everyday health. Every person is different. If you have persistent constipation that does not improve with the strategies we have discussed, please see a doctor for a proper evaluation. There can be underlying causes that deserve attention. And a clinician who takes your concerns seriously can be one of the most valuable allies you will ever have. If you take medications regularly, some of them can contribute to constipation. A conversation with your doctor or pharmacist about whether any of your medications might be playing a role